welcome to my podcast, Up Your Total Glow, your podcast for your body, mind, and soul to support, guide, and empower you to uncover your most glowing, healthiest, and feel good version of you. I am super excited that you are here because if you ask me, there's nothing that looks and feels better. In today's episode, I'm speaking with the absolutely brilliant Dr. Robert Thompson. Dr. Robert Thompson is an integrative medicine and oncology doctor, and he exposes the lies and misinformation that are perpetuated by healthcare professionals. Dr. Thompson faces steep criticism, competitive motives, and biases, leading to many false allegations. Yet, he persists, leading the shift towards integrative medicine with a focus on genuine patient well-being. This is a very different interview, and I know you will absolutely enjoy it. Dr. Thompson shares with us why potassium is the most important mineral in our physiology. He speaks about the vitamin C supplements and why they are harmful. He speaks about the ferritin level and why this is the most important of all blood tests. He says that a low salt diet is actually harmful 90% of the time. And there's so much more that he shares in this amazing interview. Please enjoy. Here he is, the amazing Dr. Robert Thompson. Hello and welcome, Dr. Robert Thompson. I am so excited to have you here today. How are you?
I'm wonderful, thanks. It's really nice to be talking to you, Ruth, and I know this is the second time. That's a privilege. I appreciate it.
Same here, and I can't wait to dive into this conversation. And as I said before, to not only have you just for myself and soak up your amazing knowledge, but also to share your wisdom with the world and with my audience. So you are super passionate about reshaping health through nutrition. What does this mean for you?
Well, I teach some pretty basic things, and they're all in my new book, should be coming out. Well, my goal was to be done by May 1st. My publisher today is like, Robert, you gonna be done by May 1st? I don't know, Brian. It's day to day because you only get so many hours to edit on a regular basis. But the bottom line is we've talked about we all have to stop dilution. The two most important things we put in our body every day are water and minerals. And I got it wrong. And I've been encouraging patients to take minerals 3 or 4 times a day for the past 23 years. But I realized that I drink water 6 or 8 times a day, or juice or tea or coffee. If it doesn't really matter, if you're drinking, you're diluting. And so we have to realize the importance of minerals, and I think reverse it so that now I'm telling patients, when you have thirst, think of your thirst of your body for minerals first, then water. Give the minerals water. Minerals work better with water. So it's an interesting concept. I'm of course, to put it in my new book, that two most important things, water and minerals, but let's put minerals ahead of water. So when you get thirsty, the first thing you think, I need minerals to go with my water. I tell my patients, put minerals in your car, your kitchen, your bathroom, your workstation, your computer, wherever you are, put minerals right there. So you can't possibly ever drink again without helping yourself to some minerals. It's a fascinating concept. And I'm really convinced for the first time in 23 years that we're going to make a difference in the levels of patients' minerals over time by correcting dilution. Everyone's going to do it at a little bit different pace depending on the GI tract and its absorption. But more and more now, I'm helping patients realize that the minerals are not the problem. If you're not absorbing them, it's a GI problem. So let's fix that, right? Because it's not just the minerals we're not absorbing, it's lots of other things. So we work on all that stuff. And then remember, the second thing I think is really, really, really critical for everyone is to realize that the most important of all minerals to human physiology is potassium. Who would guess that? I've only had one person actually guess it correctly in 3 years. And I've had no doctors that could answer that question correctly. And I don't fault them because I didn't know it either until I read Dr. Pollack's book in May of 2021. I got to page 119. I almost fell off my stool. I couldn't believe it. I couldn't believe it. I'm like, I'm not sure what prompted me to read that book, but Dr. Pollack is an amazing teacher, and I'd read his book on water. I'm like, well, why don't you read his book on physiology? You haven't read a book on physiology since you were in medical school 40 years ago. I'm like, dang, Robert. I mean, I've read lots of other stuff, obviously, but a specific book that just deals with the cell to cell mitochondria and all that kind of stuff we deal with. And so when I got to page 119, and he says in there that potassium is the mineral of highest concentration by molality, that's a concentration gradient, of all minerals within the human cell. I'm like, holy cow, Robert, you nailed it. I've been saying this since 2008, right? My first book. And then I've been teaching about these different types of hypothyroidism because thyroid hormone can't work without potassium. And remember, blood tests only measure 6%. Hair measures 94%. So I call the blood test the stupid doctor test. Mary Kay laughs at me when I say that, but I'm like, why would you test 6% when you could test 94? Are you just stupid? Obviously. Okay, so we need to test our 94% of the most important of all minerals to human physiology, potassium. Gerald Pollack, 2001, Cells, Gels, and Engines of Life, page 119 to 122. I tell doctors, read it. Don't tell me I'm wrong. Go read it.
Thank you so
that
much.
would
There was so much in all of this. So let me ask back and check in with you. Yes, so we dilute our minerals when we drink water. So here's the new concept. Think of your minerals first and foremost when you're drinking water. So you are referring to supplements always. Let me ask you, why do we need to take supplements? Why can't we just try and eat foods? Aren't they enough minerals in our foods anymore? And what minerals do you suggest to take and in what strength?
That's a very good and a very huge question. It could be a whole lecture in the big picture of things. There's a few things that I try to emphasize to eat clean. Go to momsacrossamerica.com and log in to find out about how to eat more clean. They're pretty good. They have lots of fantastic suggestions. Second thing you want to do is you want to realize that there is no nutritional value in our food. It's all killed. The maximum density of water is 39.1 degrees. I don't make this stuff up. It's science. When you go below that, you get ice molecules. Ice molecules, it turns out, are atomic knives. Now, that's an original term from me. So if somebody says that water molecule is atomic knife, okay, then refer to Dr. Thompson. And I'll refer to Dr. Pollack because he shows that as you go below 39.1 degrees, you begin to form ice molecules. Ice molecule is a flat, completely flat planar molecule. It's flat as a knife, so it cuts everything to pieces. So when the grocery stores chill your fruits and vegetables to 34 degrees, they're killing everything we want in our fruits and vegetables, especially the C molecule. So remember, I teach that that's number 5, actually. We'll get to that in a minute, but So we have to have potassium. We have to measure it properly. And why is it important? Dipoles. I tell my patients, write that down, dipoles. What's a dipole? Well, it's a simple word. Di is two poles. Two poles would have two poles, a battery. It's a battery. And so it turns out potassium is attached to our protein molecules at every other carbon at the -14 negative charge, which I love telling stories about that. Anyway, this potassium electrostatically attracts water. This is from Dr. Pollack's book, and it creates this dipole. Dipoles are batteries. Batteries are in parallel. So each one of our protein molecules, average 430 peptides in length, has about 215 batteries. Dang, that's a lot of energy. Matrix might have been correct. The movie, do you remember the movie Matrix?
Yeah.
Remember they had all the people plugged into the batteries?
Yeah.
Might have been some truth and all that stuff. I figured out, I did the math on it, and this is in my new book, by the way. There's 63,215 gazillion batteries in every cell in our body. What does it do? What does it do? What does it do? I don't know. I asked that question for several months because we never hear anybody talk about direct current energy. Everybody talks about ATP, triple negative phosphate, and its power is generated by our mitochondria. It's really important, and we need mitochondria to generate mitochondria. We need mitochondria to make heme molecules, and heme molecules are being destroyed by spike protein. So this thing is a real serious teeter-totter going on that nobody understands because they don't understand iron. So, by the way, Joe Mercola claims that I'm the most knowledgeable person on the planet on iron physiology. I don't know if that's true. It might be. I don't know. Anyway, he claims it. He's a pretty smart guy. So whenever you get a compliment from Joe, that's a big deal. Anyway, we have to have these dipoles to create energy. And it turns out potassium is attached by ATP. So you have to have two things, potassium and ATP. And interestingly, I'm finding patients now that I put them on large doses of potassium, and after 6 or 12 months, there's no change. That's a problem. Because remember, we need ATP to attach to potassium. And so it suggests that they're not making enough ATP, which suggests that their cellular energy is going to Warburg. Remember, Warburg talks about the anaerobic glycolysis and the cancer and things like that. And that's what we see. We know that those people that have prolonged COVID and things like that, they lose so many mitochondria that they have a 3,000% increased risk of cancer just from the loss of heme molecules and mitochondria. Anyway, the key is on this that we have to restore all these heme molecules as aggressively as possible. We have to know they're going away, and we have to reduce the toxicity of the iron that's being released from the heme molecules as it's being destroyed by the spike protein. That's another podcast one of these days. At any rate, when we have dipoles, what do? They're responsible for everything in the nucleus of the cell. So all DNA replication and synthesis, DNA compaction, histones, DNA replication, nucleosomes, which are 4 histones joined together, which they're just beginning to understand because there's 6 of them and they combine in different combinations like DNA and do different things, turn on, turn off, stuff like that. They don't have much understanding of nucleosomes yet, but it's pretty cool. Anyway, they're in the nucleus and they're positively charged. Dang! I realize that's what these batteries do. They positively charge the nucleus.
Fascinating.
So all DNA replication, all RNA replication, and all protein synthesis depends on these batteries. The average person that I test has 15% of the battery charge that they're supposed to have. Imagine your Tesla has 15% of its battery charge. Dang.
Very
That's not
fascinating.
run too well.
Your perspective. I absolutely think it's amazing how you take these topics on. So I personally
Dang, Ruth, you're a smarty pants.
I
That's
personally love
yeah, yeah.
nutrition and food, have studied a lot about this and study Ayurveda, and will forever study Ayurveda. And we do use supplements, but we use them specifically. We try to more use herbs and yeah, nutrition, because the body just knows how to use it. So that's how
You know,
where I come
we
from. But I would like to
we hear
ask further. So you mentioned cancer, and you mentioned long COVID and all those things. I again think it's so interesting, your perspective on this, and like my perspective, and they can mean the same thing, just come from a different angle, is that the more inflammation there is in the body, the less adaptable the body is to actually get up these forces of your immune system. Any thoughts on that? Does that fit in with your angle of viewing things?
well, it's a problem. Our immune systems are suffering.
Mm-hmm.
I have determined that almost 100% of us are affected by the vaccine, the COVID vaccine, whether we got it or we didn't.
Absolutely.
I've been,
Spike
I've
protein.
been affected. I've been affected by it.
Mm.
I have failing T1 immunity, more viral illnesses, and activations of antibodies related to that. I've also developed lupus because of the vaccine. I wasn't vaccinated.
Yeah,
It
yeah,
was shed on. Everyone's shed on. It
yeah,
was designed to shed. It was a bioweapon.
yeah,
Okay. And it's designed to kill heme molecules.
yeah.
You can't replace, eventually that teeter-totter is a problem. And so I'm encouraging patients to, first of all, minimize iron toxicity as best you can.
Yeah.
So remember, we can't measure iron. I keep having doctors argue with me about this stuff. You know, at this point, I'm like, it's not a debate. Go read. It's a science. Okay, so um, one of my favorite teachers is Dr. D.B. Kell in Manchester, England. I've actually talked to him. I try to call up these people if they're really smart and at least interchange a little bit with them. Sometimes I ended up talking to Dr. Seafried at Boston College for 45 minutes. I'm like, dang, he's got PhD students and master students and advanced, graduate level courses to teach and articles everywhere going on. And he took 45 minutes to talk to me. And he learned a bunch of things. And of course, I'm always talking anyway about ferritin. Remember, ferritin is the most important of all blood tests. If you don't know your ferritin, you're in trouble.
So tell us about
Lower,
ferritin and about iron physiology. Since you are truly the specialist here, and yeah, can you enlighten us on these two topics, please? And what can we do to boost up our ferritin levels?
yeah, let's cut right to the chase. Okay. I'm so sick and tired of doctors and blood banks and people telling people they have iron deficiency anemia. Dr. Peter Altea just wrote an article 2 days ago or last week, I think it was, in JAMA on iron deficiency and iron infusions and iron therapy and this, that, and the other. And people ask me, actually, as of today, I actually emailed us, well, how come if patients have a low ferritin, we give them iron, they feel better? Well, you could probably give them a lot of things and they'd feel better. Who knows if it was the iron? Give me a break, doctor. That's not a prospective randomized trial. And you can prove, and they admitted it, that the ferritin goes up. But see, they think that's a measurement of iron. It's not.
And
There is no
also,
measurement.
there's a
There's,
difference in the straight away result. They might feel better straight away. And how do they feel in 3 weeks, in 4 weeks from
yeah,
then?
yeah.
So yeah,
It does. Yeah, it's probably placebo.
yeah,
Remember, placebo's 50%, and they got an IV or they got an injection or whatever. Or the doctor cares about them and made the wrong recommendation, whatever. The bottom line is we can't measure iron by any test. I keep telling doctors, iron is stored in amyloid. We can't measure amyloid, so forget about it. You're not going to measure iron. There's no test. All the tests that come from the laboratories are fictitious. They're completely fictitious. I called the chief pathologist laboratory. I said, what's the matter with you? How come you're doing this test? Iron stored in amyloid. Here's the references, DB Kell, 2009 to 2018. Every article he publishes in Metalamics, I tell doctors, read them if you want to understand iron. It's the key. But Dr. Kell and I don't agree on the C molecule, and I'm right. Anyway, the C molecule reduces iron toxicity. That's its function in humans. And we were deceived with the Hoffman and Roche drug company producing ascorbic acid, calling it vitamin C. It's a toxic substance to humans because we don't have an enzyme to break it down called galonolactone oxidase. I don't make this stuff up. In 1937, Dr. Sayori told the world that ascorbic acid was useless. I'm more specific. It's harmful. There's no safe intake of ascorbic acid. And so when people take the vitamin C I recommend that has a little bit of ascorbic acid, they always get confused. And it's just the bad quality of the products. We don't have any vitamin C products out that can help us. Fresh. Go to the farmer's market,
I would
buy it
argue
fresh.
that there is
You can get it from-
amalaki. Have you heard of amalaki? Amalaki is an Ayurvedic herb, and it is the richest form in true vitamin C. So it's not
No.
synthetic.
No, it's baloney. All those products have
amalaki.
No, they're all baloney. They're all come from freeze-dried products.
It's not synthetically made. It's nature.
It's what?
It's not
what?
synthetically made. It's not a synthetic supplement. It's a herb.
It's a food?
Yeah, it's a herb. So it grows in
And you just take it fresh?
Yeah.
And you
You can also dry it if you want to.
Everything fresh all the time. And go to the farmers markets as often as possible. Everything in the grocery store, everything at Costco, everything at Fred Meyer's, every grocery store, everything's killed. It's all dead because they're chilling it to 34. The maximum density of water is 39.1. Whoever came up with that temperature? Give me a break, health departments. That's stupid beyond belief. Nothing lasts longer. It all destroys itself when it goes home because you push ice crystals into your water, into your fruits and vegetables that cut them to pieces. That's why when you cut through them, they look mushy inside. They got too cold.
But I think, the point of the storage is not to keep things alive, actually, and not to make us healthier. I would argue that the point is to keep them lasting so that they can make more money out of it.
Yeah, you get the nail on the head. The other thing is, remember that there's a lot of places out there, like there's a new company in Anchorage that claims everything's fresh and natural and organic, and they're putting frozen berries into their smoothies. Those are all dead, killed. They're not fresh. They're lying to us. It has to be fresh. It has to be. If it's not fresh, and even if it's fresh, you don't know. In Alaska, they're not using climate-controlled trucks. We have several months of the year we can't possibly get the C molecule in our fruits and vegetables. They're all killed. Yeah. I had the worst ferritin level I've had in probably 5-10 years. I was in December a couple years ago because it was so cold. I knew it was from getting ascorbic acid. Because remember, when the C molecule is cut to pieces, it releases the ascorbic acid. It's otherwise known as hexuronic acid, which was the scientific name for it before Dr. Sayori in 1933 renamed it in his article in Scientific American. Anyway, I'm going to do that. I'm going to do an article. That's one of my goals, to finish an article in Scientific American on these things that I'm teaching, because it's like historically significant.
So what did you do to boost your iron levels again?
Sorry?
What did you do to up your iron levels again, your ferritin levels?
No, you don't want ferritin go up. You always want ferritin to go down.
Okay. So
the lower the better.
You feel your bad.
The ferritin is not a measurement of iron, it's a measurement of iron toxicity.
Okay.
Now, the next statement I'm going to make is historically significant. I'm telling my doctor colleagues, if you don't give me reference when you repeat this statement, you're stealing my knowledge. Don't do it. I'm serious. Okay. I determined this. It's historically significant. Nobody in the world has ever realized it because they haven't understood iron. It's in my book. It was in my last book, but more specific now.
I think this is awesome because I'm
Ascorbic.
all for
Okay.
the truth.
Let me make it real simple.
Mm,
Your mitochondria use iron for redox.
mm,
The iron goes from Fe2 to Fe2 plus.
mm.
Fe2 plus is very unstable and generates hydroxyl radicals. It's extremely toxic. And interestingly, the C molecule is 100,000 times faster in its efficiency in reducing that back to Fe2 than the ceruloplasmin is in oxidizing it to Fe3. So if you have C molecules, you don't produce ferritin. Now remember, this is original scientific and all published information, and nobody's connected the dots. I'm kind of like you indicated, talked about this earlier. I'm kind of a dot connector. I learn all this stuff, put it together. But when I tell my doctor friends, if you're going to quote what I'm saying, give me credit. Don't steal my knowledge
Of course.
and act like it's original. They're all doing it all over the world. I've been saying this stuff for 15 years. Don't tell me all of a sudden discovered I'm correct. Okay, so the bottom line is we need to keep reducing this iron toxicity throughout our bodies, and spike protein binds to beta-1 heme at the N-terminal domain, causing a release of free iron. So we have this battle going on, and we have to keep supporting it with C molecules on a continuous basis
And
to
on a
keep trying to
practical level, how do
regenerate.
we do that? On a very practical level for my audience, how do we do that, doctor?
Fresh, whole, all the time.
Yeah.
Certain foods have higher concentrations of C than others. You can look all that stuff up.
Yeah.
I know Joe eats cockadoo plums every day. They have about 8 times the vitamin C of regular oranges. And I'm like,
See,
dang.
Amalaki is similar to that, what I was suggesting before. Yeah. Okay. Great.
Yep.
Love
Yeah,
it.
but remember, if you're getting the freeze-dried powder from the cockadoo plum, it's zero benefit.
Yeah.
It's all killed. Freezing destroys the C molecule, period. There's nothing left. It won't work. Now, there is some discussion out there about the use of sodium ascorbate, and I'm not against all that. I'm in support of some uses of it. I actually do it in my office, things like that. But we have to understand it's not a vitamin. And what I tell doctors, if you're going to some doctor that's giving you IV vitamin C, they're lying to you. They're deceiving you. It's a lie. There's no IV vitamin C. There's IV ascorbic acid. There's IV sodium ascorbate. Those have been referred to as vitamin C. They're not vitamins. They're sugar molecules. One has 2 hydroxyls. The other has 1. And I don't make that stuff up. It's chemistry, right? So don't be lying to me and tell me it's something different than what it is, or tell me it does something different than what we know it does. And we know if you get ascorbic acid or something, ascorbic acid ferritin level goes up. Anything that makes ferritin level go up is bad. They actually pointed out to me today in their discussion for people feeling better that ferritin goes up, and when they give iron infusions and stuff like that, I'm like, it takes a week for it to come back down. I'm like, dang, that's a lot of death to mitochondria. Ferritin is an indication of toxicity of iron.
Fascinating.
If you're recycling iron, this is the statement. You don't make ferritin. And what recycles iron is the C molecule. It reduces it. It takes it from Fe2 plus back to Fe2 for reincorporation into FES clusters. I want you to know that's an historically significant statement. Nobody in the world has ever put that 2 plus 2 together before and connected the dots. Nobody, ever. And
So
I'm
why
like,
do you
dang.
think, sorry for interrupting, but why do you think doctors are so adamant about the ferritin levels and keep promoting we need to be mindful of those ferritin levels, and that it's really important for health? That's what I learned in my studies as well. So for me, this is really fascinating.
2 days ago or last week, I can't remember, Peter Attilia wrote this article on iron and its deficiency and replacement, all that kind of stuff in JAMA, Journal of the American Medical Association. Within days ago, every single thing in his article is wrong.
Wow. Yeah.
Every single thing. Every single thing. And I'm like, the answer to your question is, I have to ask, is he illiterate or stupid? I don't know. Mark Twain said it best. There's no difference between a man who can't read and a man who doesn't read. And he's basically taking all the wrong old information and redigesting it and taking his clinical experience and thinking he's got it right. He doesn't. He's harming patients. Sorry. Everyone that's giving iron infusion is harming patients. Do you know what I tell? If somebody has cancer and they have anemia and their doctor puts them on iron, you know what I tell them? You got to go to hospice. You're going to die.
So what's your solution to anemia? Or does there have to be a solution?
The solution to anemia is the correct form of vitamin C to enable your body to utilize copper so you can make heme molecules. You can't make heme molecules without copper. Copper is actually in the heme molecule before iron, and it requires vitamin C to do that. And they're all taking their ascorbic acid and thinking it's vitamin C because they're deceived. By the Hoffman LaRoche drug company who first made ascorbic acid. And this deception has been going on for, well, since 1934.
I 100% agree with you.
90 years of deception. And Dr. Signori told the world it was useless in 1937. I'm telling the world it's harmful because it destroys. I have 23. I thought I had 9 articles. Turns out I have 23 articles on ascorbic acid destroying the ceruloplasmin enzyme, or peroxidase, which is the enzyme that enables your body to convert the used iron, Fe2 plus, toxic free radical generating, to Fe3, so it can put it in ferritin to get it out of the mitochondria because it's so toxic.
Where can we find those articles? Where can we find your work, Dr. Robert?
Well, start at the Calcium Lye courses online. Calcium Lye 2 is available still. I have about 14 books in the work. They're going to start coming out pretty fast, one after another. The Calcium Lye 3 I'm working on right away. And that has these 5 new things that I'm teaching: dilution, potassium, #1, dipoles, zippers, and iron. Iron is the key. And so when we put those 5 things together, like I tell my colleagues, that's me, that's for me. Don't be telling everybody that you're so smart and you figured it all out. This is very, very, very significant differences, but what everybody's heard, right? And I'm not making it up. I'm kind of got it all well researched and documented. And so, but the books are coming. I've been really not been giving out all my references all the time, but we have AI now. We can look up references so fast. It's unbelievable.
Yeah.
And it's just, I always challenge AI, like I want to find out how smart he or she really is. Like, so I asked very difficult questions like, okay, what's the angle of attachment of phosphate to the ribose sugar molecule in ATP?
It's so funny that you do that, because I do a little bit the same in my area of expertise. I also play with that and see, like, what can I find that she is not quite right on, and it's fun. Yeah, okay. Tell me, I would be...
You know what I tell everybody? Keep asking why.
Yeah.
And ask me why. When we ask why, we learn. I'm like, dang. I have patients sometimes when I'm trying to teach and they start trying to tell me what they think they know. And I'm like, no, just ask me why, because it opens your brain to learning.
Absolutely.
It's a fantastic,
and this
it's a
is
fantastic
one
question.
thing I adore about you, that you keep doing this too. You keep learning and growing, and also, yeah, not being shy of letting us know if something that you thought were the only truth in the past is no longer that. So I really love that about you, and I think that's one of your super qualities. I would love to hear, what does a day in your life look like? So what are you eating, and what's the first thing you're doing when you're getting up?
Dang, those are really good questions and difficult ones. And I want to remind everybody that we don't have to be perfect. We're all working at it.
Yes.
It's a really important thing. And we kind of gradually, add on things, and a lot of people are doing too many things and they don't really get it. It's not simplified, things like that. But first of all, if you don't have a hair tissue mouse, don't be supplementing. You're going to be wrong 90% of the time. Mary Kay, my sweetheart's always asking me, like, so-and-so says this, so-and-so says that. And what I say to her, did they use a hair tissue analysis on all their studies in their patients? No. Okay, well, then we know they're wrong 90% of the time. It's not okay. We have to use that test to measure potassium so we can figure out what the dipoles and the cellular. So half of all cellular energy, half of all cellular energy in the world is not being measured by anyone. I pointed this out in my Nobel lecture on 11/4/2023. Half. Everybody missed it. Warburg missed it. Signori missed it. Linus Pauling missed it. Dr. Seafried, University of the Boston College missed it. Everyone's missed it. Half, because they're not measuring it correctly. And I'm like, dang, Robert, you really nailed it. I've been saying this stuff for 15 years, and I had no idea that I was right. That's what's really well, I kind of knew, but I didn't realize how important it was. I think that's a more accurate statement. As soon as I read Dr. Pollock's book, and I said, I almost fell off my stool. I'm like, dang, it's really important. You have to measure this stuff correctly. And we have to all keep working at reducing iron toxicity. For men, it's really important. The formula for men is age minus 12 times 2. That's how many units of blood you need sucked out of you to try to get some semblance of neutral iron. That's if you don't eat meat. For women, it's menopause, current age minus menopause, and age times 2. And so that's how many donations you need. So, if a woman's 70 years old and she has a hysterectomy at age 35, she should have already donated 70 times. 35 times 2. So, nobody's thinking about this stuff. Nobody's measuring this stuff. Nobody really understands it, things like that. So remember, this stuff about what I'm teaching about the C molecule, most important function, number one, most important function,
how can the
reduce iron.
person know or understand this when doctors are all the time advertising something else? So I think it's
Good
really
question.
hard.
Good question. I think, first of all, do your hair tissue analysis right away. Everybody, just do it. You can get it from my site, ruralhealthandnutrition.com, or find somebody that provides it. The second thing you want to do is get your ferritin level. Everyone needs to know their ferritin level. It's the most important of all blood tests. Did you know ferritin is the only blood test, the only one, that's directly related to all death and disease and morbidity and mortality? And for every 100 points it goes up, that's increased 10 to 15%. So if your ferritin level is in the normal range and it's 200, you have a 20 to 30% increased risk of death and disease in the next year. And the laboratory, LabCorp and Quest and all the other labs are not changing their normal values. And it's really upsetting me because it's unscientific. It's published. Dr. Kell, everything from Dr. Kell. I tell you, you got to read what Dr. Kell says. It's like he's a genius. He's one of the best teachers in the world on iron, and he's in Manchester, England, anyway. The guys that get into iron, we pretty much pay attention to him, but he doesn't pay attention to everything I say, which is okay. And nevertheless, we have to keep reducing that iron. Turns out anything that increases ferritin is bad for us. So it's pretty simple. Keep checking it. If you're doing something new, maybe get another ferritin. If it goes up, something's the matter. Nothing should make your ferritin. You want your ferritin as low as possible. You can't be too low. It's not an iron measurement. We have no iron measurements. Amyloid is a storage protein for iron. We can't measure amyloid. So forget about it. The blood tests are stupid doctor tests.
I'm so fascinated because it all makes so much sense. Yeah, thank you so much for sharing this. I would love to hear, what would you recommend in terms of spike protein? So what can we do there? Is there anything we can do to boost our immunity, to boost our bodies, our defense mechanisms?
That's a great question, but let's back up just a second. So what's happening is free iron's being released from the heme molecule at the spike protein attaches to the N-terminal domain of beta-1 heme. I'm very specific. When I say that, it's published March 2020. The reason I say that is because I don't want somebody coming back and trying to criticize me, take my medical license, because all I'm doing is quoting the published article.
Yeah.
I happen to understand its significance.
Yeah.
Because that release of free iron is unlignin iron. Everything Dr. Kell publishes, I've read everything Dr. Kell publishes. So I know about the toxicity.
Yeah.
Okay, so that's the problem. So your question is very excellent. The problem is that 20 of our 23 chromosomes have been permanently altered to cause them to produce spike protein on a regular, continuous basis. To what degree is doing that? We don't know. High, low, in between, we don't know. We can't measure it. There's doctors out there, including some of my colleagues, that are selling supplements to, quote, neutralize spike protein. That's impossible. You can't do it. I've already told the world the only treatment for this is CRISPR. You got to excise that DNA change and get rid of it, or you're going to keep making spike protein in your DNA forever. It's programmed now, and no one's listening. Okay, so and who would want to use CRISPR for this when you think about how what a big program, what a big project that was? But honestly, a lot of lives might depend on it in the big picture because we got this change making us make spike protein, which kills heme molecules. So what I teach is we have this teeter-totter of heme molecules. Mitochondria make heme molecules. We need more mitochondria to make mitochondria. We need heme for everything to work. And so heme's made in mitochondria. So if we're killing off mitochondria, it's an insidious death.
Yeah.
If we're losing heme molecules, it's an insidious death. Sorry, it is what it is.
Yeah.
Now, that's the normal physiology of the human disease. So in my book coming up, it's called The Vitamin C Lie, I express the fact that we're all dying of chronic scurvy.
Yeah.
We're dying of iron toxicity over our lifetime, whereas acute scurvy is no vitamin C, die in 3 months, and that's a fascinating disease. I love teaching about it because it's even, and the history is even more unbelievable. I mean, dang, I could probably go on for hours on the history of vitamin C. It's like because you can't believe the amount of evil that was in the world, even in the 1700s, and so anyway. So we all have to get the C molecule to reduce iron toxicity. And so the answer is to keep reducing iron toxicity. When I have patients that have vaccinated and now they feel bad and they know they've been harmed by the vaccine and they know they've been lied to, they know they've been deceived. And I just grab their hand and I say, I have the disease also. And I didn't vaccinate.
Yeah.
And so we're really every one of us is in this together.
Yeah.
So everything I've been teaching about cellular energy and minimizing iron toxicity, dang, it turns out that's the answer.
Right.
That's the answer for everyone. It's the answer to begin with, but the process has been accelerated by spike protein, so we have to fight back.
Yeah.
So things that support mitochondria, things that reduce iron toxicity, making sure our ferritin is low as possible, correcting potassium, correct thyroid treatment. That's huge. We should do a whole show on that one of these days.
Should. Absolutely. I so want to have you back, doctor, for this one because I have many clients with thyroid issues. So please, let's do this. For today, can you please name 3? I mean, you've given us an amazing range of wisdom and knowledge and truly made me think and blow my mind. I'm sure you've blown my audience's minds, but can you give us 3 golden nuggets, 3 quick things my audience can remember that will help them to live a healthier, happier life? Just 3 golden nuggets.
Did you say happy in life?
Healthy and happy.
Healthy and happy. Well, one of the things that is in my book, chapter 8, and is kind of not all that predictable, is stress. And stress affects our adrenal glands. And then our adrenal glands respond and cause us to retain a little bit of sodium. It's a small percentage of the population, only about 5 to 10%. Most of us don't retain sodium. Most of us need sodium. Those people kind of need to know But I've realized over the time that we might all need to kind of keep treating our stress. And how do we do that? My recommendation is the slow walk. I've never seen anything work like the slow walk. Um, my sweetheart's a PhD psychologist, and she said to me, "Well, I don't like to walk slow. It stresses me out." She likes to go fast. I talk to a lot of patients to say the same thing. I'm like, well, 6 months later, I said, "Okay, well, you're the PhD psychologist. Figure it out. What makes your stress better?" 6 months later, she wasn't better. So then we start bartering, right? Because I'm not a dictator. I'm just kind of like, okay, well, what if you walk slow in this part of your walk? And then she started going to the beach and doing slow walks on the beach. I truly expect her to have fantastic improvements in her next heritage analysis. But I had one patient that was a 35-year-old mom with 3 kids, 1, 3, and 5, and I started thinking about the engineering of a 1, 3, and 5-year-old, and I'm like, dang, that's a hard mom time. And so I got her taking the kids she had a stress pattern, got her taking the kids for a walk every day for 3 months. And she came back into my office with her heritage analysis. And I'm like, I would have told her, wait, it's too soon. But she changed it. It all changed. Everything had gone back to normal with 3 months of walking. I'm like, dang, that's a powerful change on physiology. What I describe it as is resetting your Game Boy.
Yes.
When you go take that that slow walk, it resets your adrenal gland in response to
Yeah.
your feelings. That's all you're doing.
Yeah.
You're
Love
gonna
it.
still have feelings. I tell everybody, I want you to have feelings. If you don't have feelings, you're dead. So please keep having feelings. And so, but it's remarkable how it affects us. And Mary Kay always thinks that I have so much stress, which I do, and yet I don't have a stress pattern on my heritage mouse, but I practice what I preach. So I do my slow walks and I haven't found too many things that work better. And so I know I can't really stop doing it. I have to keep a little bit of it in there. I tend to cheat. I tend to go like 15 minutes instead of 30 minutes. So if you do that, okay, great. You're still doing it, right? Quit beating ourselves up. Keep working at it. This is a lot of work getting more healthy. I mean, doing the right things, and knowing and having confidence that they're right things. So start with reducing iron, get on the whole C. The one in my site is pretty good because it's 98.5% intact C molecules. I've been testing them all over the world. And I don't know about Australia's C because I think it gets frozen on the airplane. Put it on this way here. So I'd have to probably go to Australia to test it. Um, right there, and you'll be able to test it pretty much by just checking ferritin. So you check a ferritin, then you start taking it, and then if your ferritin goes up, you're getting ascorbic acid. If your ferritin doesn't go up, maybe it's the real stuff.
Awesome.
There are other things. There are other things that can make ferritin go up, but in general, it's always uh, a real significant iron overload or lack of vitamin C. Remember, in scurvy, patients will have ferritin levels in the thousands. Same with hemochromatosis, sometimes in the thousands. With acute COVID illness, the most severe patients I saw, I had one patient at ferritin of 3,000. Uh, my colleagues know, and I know, if you have a ferritin over 1,000 and you have cancer, you're going to die.
Yeah.
It's a big deal. If your oncology doctor's giving you iron, he's killing you. Don't do it.
I
Don't do it.
love
You
your
need C
work.
molecules. You need C molecules. You need copper, and you need what else? You need cellular energy. You got to correct thyroid because that energy is everything.
Absolutely.
And everyone's talked about it. We need energy. Thyroid's what generates energy. Do you know I've been doing this for a while. I can't find a doctor that knows the most important of all minerals. I can't find a doctor that knows where thyroid hormone works.
We
Where
have
does it
to
work?
have you back, doctor. This is awesome. Please, let's continue this conversation. There was just one thing I slightly disagree with, that being healthy, living a healthy life is work. I would like to challenge you on that and say it actually can be fun and exciting. But thank you so much. I so appreciate your work. You have definitely given me lots of new insights, things to think about. You have inspired me. Yeah, you're amazing. Thank you so much for making our world a healthier, happier place. I'm super grateful to you, and I
Thank
can't
you.
wait to have you back. Thank you so much.
Thank you. Those are wonderful compliments. You know, when I think about it, one of the things that you know, comforts my heart the most is it's work to be a teacher. And when you start teaching, it's like, wow, this is a big responsibility.
Yes.
And so when I have an article that came through like JAMA a couple of days ago that's just completely wrong, I'm like, what do you say or do about that? You know, as a teacher, I'm not trying to hurt somebody, you know, I'd be critical. I used to have that stupid knowledge also before I started reading Dr. Kell's work in 2015 or so, and Morley Robbins called it to my attention, and I'm like, dang, everything's wrong.
Yeah,
I'm like,
same
okay.
here. We learn, we grow as long as we speak about it, you know. Yeah. Thank you so much. Honestly, I'm super grateful.
You're welcome.
You're amazing.
You're welcome. I look forward to next time.
Take care.
You take care, Ruth.
If you love and enjoy my podcast, then please do me a favor and share this episode with simply one other person who you know would greatly benefit from it. This way, you help to make our world a healthier, happier place. Because we are all born to thrive, to feel absolutely amazing in our beautiful bodies, brilliant minds, and boundless souls. So what are you still waiting for? Please make sure you do. I'm your biggest cheerleader. Keep glowing. Much love.